Hi, I'm Joseph Pate, better known as Medicare Joe. In this video, I'm going to go over how Plan N works, what it actually covers, and who is it really the best fit for when getting onto Medicare. So to start off on what Plan N is, for those that don't know how a supplement plan works, Medicare covers A and B, and that's going to be covering you at 80% of your medical bills. So when you go with original Medicare, you need to buy a supplement plan to cover the 20% that Medicare doesn't cover. So that's where Plan N comes in. It's going to pick up that 20% gap as a Medicare supplement plan. The difference with Plan N versus Plan G is that once you meet the $283 deductible on a Plan N, if you were to go to the doctor again after that point, so we have the $283 deductible, we go to the doctor again after we've met that, they can charge you up to a $20 copay for that doctor visit. And if you go to the emergency room, they can charge you up to a $50 copay. So it is a supplement plan that covers you in totality on the 20% gap, but we do have these little out-of-pocket costs that can come up during the year for doctor visits and ER. So with Plan N, it works just like any other standard Medicare supplement plan like Plan G, where you don't have a network of doctors. So there's no network you have to worry about keeping your doctor or staying in. If the doctor takes Medicare, they have to take your supplement plan. And there's no referrals that are required. And quite frankly, it's the second lowest out-of-pocket cost option when it comes to looking at what is my total out-of-pocket exposure when on Medicare. And now who it's for is gonna be up for debate. So Plan N really, in my opinion, is best for people that are relatively healthy and they want to be protected in the event that they do end up needing to use their insurance quite a bit. So it's a really good fit for people that go to the doctors, anywhere from 2 to 10 times a year. They're comfortable having those small out-of-pocket copays of $20 at the doctor, $50 at the ER. Like, that's not a huge concern for them. And they're really looking for a balance between what they're going to be paying in premium versus what they're going to be getting in coverage. They don't want to be overpaying in premium and not using the plan. So they're budget friendly. I always say they're really looking for what is the best bang for my buck, is a phrase that we use here with our team all the time. As a recap for this video, so the way Plan N works, again, it's going to work with your original Medicare. It supplements original Medicare, covers that 20% gap. It does have much lower premiums than the Plan G. If Plan G is budgeted around $150 a month, Plan N usually comes in about $100 a month. So it's much more affordable on a monthly basis. It does have small copays that you'll have to pay when you start using the plan for the doctor and the ER, 20 at the doctor, 50 at the ER. And it's really best for people that are looking for that optimal balance between cost and coverage. Again, we say that, in my opinion, this is the best bang for your buck plan when getting onto Medicare if you're picking a supplement plan to go with your Medicare coverage. If you're getting onto Medicare and you're looking for the plan that has the most predictable healthcare costs, chances are you're looking at Plan G as a Medicare supplement plan. It's one of the most popular options that people pick. In this video here, I'm going to break down what Plan G is, how it works, and really who it's best suited for. So let's start with what Plan G is. Plan G is a Medicare supplement plan. So what that means is you have your Medicare Part A and B as your primary insurance. It's going to cover you at 80%. And then you are buying a supplement plan to cover the 20% gap in coverage. So the way that Plan G works and what it covers is if you go to the hospital, if you have doctor visits, surgeries, stuff like that, that is where your Medicare is covering you at 80%. The supplement's covering you at the 20% gap. Well, with a Plan G, it covers that full 20%. The only thing that you actually have to pay out of pocket is what is called your medical Part B deductible. And that's a yearly deductible you pay, which is $283 as of 2026. Once you pay that deductible for the year, everything beyond that is covered now at 100% for that year, obviously if it's approved by Medicare. So Plan G is like what I consider the Cadillac coverage when it comes to picking a Medicare supplement plan. You can't get any better. And the reason why you can't get any better is because it's the highest level of coverage when it comes to your out-of-pocket costs that you pay when you're on Medicare. But also you don't have any doctor networks that you have to worry about. If the doctors take Medicare, they'll take your supplement plan, no matter who the carrier is. You don't need referrals to see physicians. You don't need prior authorization to have stuff covered. So a very flexible option, but it's not for everybody, right? So if you're getting flexibility and you're getting the highest level of out-of-pocket costs that you can get, it's going to come at a cost, right? It's going to come at a premium. And that is really the one downside. So with Plan G, yes, it covers you at, that Cadillac tier coverage. The only out-of-pocket cost you'll have is that $283 yearly deductible that you pay on Part B, but you're going to be paying a higher premium than other supplemental plans that are out there, and also a higher premium than if you were to go on a Medicare Advantage policy. So you really just need to weigh the pros and cons of where you want to end up. So just to recap this video on what Plan G is. Plan G works with your original Medicare. It supplements your original Medicare. It covers that 20% gap in coverage. It covers almost all of the out-of-pocket costs. The only thing that you actually have to pay for is that $283 annual deductible as of 2026. You can go to any doctors, hospitals you want to go to. There's no network, there's no referrals. Basically, it's just going to pay whatever Medicare tells it to pay. And then the one caveat, again, it's your highest level of coverage when it comes to a supplement plan, but that also comes at that higher premium threshold. So it is for people that want predictable coverage, and they want peace of mind, and they can afford it. It might not be for everybody who is more budget driven on trying to find the best bang for your buck on a monthly basis. And in this specific video, I'm going to talk about why Plan N has now become the most popular Medicare supplement plan, why the math actually works out, and why for a lot of people it's the stronger option to choose for your supplement plan from day one of getting onto Medicare. So why are people moving from the Plan G to the Plan N in the first place? Well, we do plan reviews for our clients every single year. And the common theme that we've seen here over the last 6-7 years is that the goal would always be to replace the Plan G with another Plan G just at a lower premium. So you're basically resetting the cost for the same exact coverage that you have. You can do that if your health allows you to annually. You can change whenever you want. The problem is what we're finding is that with the Plan G of late, the last like 3 or 4 years here, is that Plan G just goes right back up again. So what ends up happening is you end up getting into this loop, if you will. So you're going through the same process every year. You're shopping your plan, you're switching it, trying to save money to reduce the rate, and then all of a sudden that rate increase hits you again, and some of them are about 40% for the year, which is just astronomical. And that's when we really sat down a couple years ago and looked at the Plan N and spoke with our clients and introduced that as a possible solution to look at, because the problem would just continue with that loop and they would just keep getting rate increases. And it didn't become, how do we get this cheaper every single year? But it actually came out to being, is this even the right plan for me anymore? But here's the other side of it too, is that, and a lot of people don't think about this, if you are on a Medicare supplement plan, Plan G, and your rates have gone up and your health doesn't allow you to switch, you're now stuck on that Plan G with these massive rate increases. We need to make a decision. Is this plan even still within your budget to pay for monthly? And since we can't health qualify to change to any other supplement plan, we're now at a crossroads where we need to think about, can we stay on this Plan G and afford it? Or do we have to now look at Medicare Advantage, which is a completely different type of healthcare for you to change to just due to affordability? And all of that stems from making the right decision when you're getting onto your Medicare. So that's why I think it's so important for people to understand the Plan N, how it works, and it's ultimately why a lot of people are moving towards that as being their number one choice when getting onto a supplement plan. So let me paint this picture for you here. The Plan G has always been positioned as that safe option, that safe haven, if you will, on the Medicare supplement side. It's very straightforward coverage. You pay your $283 Part B deductible, and then that's it. You don't pay anything else after that. You just pay your monthly premium. You don't have to think about any out-of-pocket costs. But again, what's happening now with that Plan G is because you have all of those little copays, small things, everything's getting paid for by the Plan G. And that's where these rate increases have gotten up as high as 40% in a year, averaging at about 15 to 20%. Now, alternatively with the Plan N, I'll talk about the math here and how it looks. It's a much more stable supplement plan, you're looking close to like 5 to 10% on average with those rate increase, because there is some cost sharing that happens. But because there's that cost sharing that happens, you have much more stability when you compare the two side by side and what their rate increases will eventually get them to in 3 and 5 and 10 years. And that's extremely important, because as your health starts to change, and now you can't health qualify to make any changes, you want to be on the more stable supplement plan at the end of the day. Just to kind of give you a quick side-by-side comparison here, with the Plan G, you have your $283 deductible, and then that's it. You don't pay anything after that. Well, with Plan N, you have that same $283 deductible. The difference is after you meet that deductible, if you go to the doctor, specialist, primary care, you can pay up to a $20 copay, up to, that's the highest. And then if you go to the emergency room, you pay up to a $50 copay. So that's the trade-off. Now, in terms of premium between the two plans, the Plan G on average is about $75 more per month in premium than the Plan N would cost you. So if we just annualize that out for the year, $75 a month times 12 months, that's paying an extra $900 a year in premium for the Plan G over the Plan N. Now, with the Plan N, we have those small copays. So let's say we go to the doctor even 6 to 8 times a year. We're only going to be paying copays of $120 to $160 in totality for that whole year with Plan N. If we were on Plan G, we were paying $900 in premium to avoid having to pay that $120 to $160 in copays. So with Plan N, you are coming out significantly ahead, even if you're going to the doctor 6 to 8 times, which is still quite frequent for a lot of our clients. Most of our clients usually only go to the doctor 3 to 4 times a year if they're fairly healthy. So for many people, the Plan N is becoming the smarter financial decision to pick, not because it covers more, but because it's more aligned with how people want their actual healthcare to work. And with our clients, I'm quoting it as the best value plan, the best bang for your buck, because you have that constant stability with rate increases moving forward into the future. Now, Plan N might not be right for everybody. And I want to make sure I make mention of this on this video, because Plan G still does make sense if you go to the doctor a lot, or you just want that convenience of zero out-of-pocket costs and premium's not really a concern for you, right? You don't want to have to think about bills, and you have the ability to just pay the extra premium and not have to worry about having to pay a copay at the doctor. Then Plan G might make more sense for you. But we are just seeing a constant shift of people, and in 2026, the Plan N hands down has been the most common choice that people are picking. They're not just asking, hey, what does it cover? They're actually looking at, does this make financial sense to me, not only today, but more long term? So I want to quick recap on this video here before we close out. Replacing Plan G with just another Plan G is just going to put you in that constant loop of having to do it every year. So look at Plan N, see the cost difference and if it makes sense. Some people that are in that constant loop, they're stuck with Plan G, they can no longer switch if their health allows them to not qualify anymore. So now they need to make a decision, can I afford this expensive Plan G, or do I have to go to Medicare Advantage, which is a completely different product? Plan N is acting as that lower premium with the same level of care. And for many people, that savings that I just mapped out with the math outweighs and acts as a massive savings for people that are on a supplement plan. If you're trying to decide between Plan G and Plan N, or you're getting hit with these massive rate increases, there's a link below. You can schedule a call with our team members. We can walk you through your options. If you know of anybody that has a supplement plan that's getting hit with these rising costs, like our video, share our video, subscribe our video. You don't know what you don't know. So getting this in front of people that are on Medicare is important to me. That is my mission, to educate our seniors. That's the whole purpose of this channel. So again, if you want to be updated when we post new Medicare updates and different things like this video, hit the subscribe button. You'll be notified when we post any new YouTube videos here on the channel. Thanks for watching.